Hello and welcome to my YouTube channel. My name is Wangui Mwangi. Today I'm going to do a very short video about the Nursing Council of Kenya examinations or the licensure exams. So as I had said earlier in another video, the Nursing Council of Kenya is the body mandated by the government or the Kenyan government through an act of parliament, Cap 257 of the Kenyan Constitution, to ensure that the nurses practicing within its jurisdiction meet the acceptable levels of competency. So one of the ways they ensure that they get competent nurses to work in their sector or within Kenya, it is through ensuring that after completion of school or college, then you go for a licensing exam. For basic cadres, that is for certificate, diploma and first degree, you do 4 papers. There is paper 1, paper 2, paper 3, paper 4. For other cadres, especially those doing post-basic and other levels of nursing, then they do 3 papers. So there's paper 1 to paper 3. So I will dive right into what each paper entails, but not in so much details. Just to say that these papers usually comprise of questions, and they are marked out of 100, and they have 3 sections. Section A has multiple choice questions, and they are usually about 20. Then section B is short answer question or SAQs, and then we have the third section, which is long answer questions or LAQs or the SE questions. So the 3 different questions are meant to see how well one is versed and has mastered the subject of nursing in all practices or in all settings. And I'll be going into specific details about each paper, but then this is a very good way for you to come back, because MCQs will test your broad knowledge and it will be wide. You have to have you should have studied well for this. The SAQs, you can at least give and explain and state some of the things that you know about nursing, depending on the questions asked. The long answer questions, I think these ones are usually more of application questions, so you shouldn't be able to fail this one at least, because it is something you have gone to school for, you have practiced, you have a bit of knowledge. You can be told to do a care plan, you can be told to give about a care of a patient, you're told about Mr. X and what he requires, and then you're supposed to come right in and plan his care. So this one should be a little bit easier. The SAQs and the long answer questions are usually easier than the MCQs. I don't even believe I am saying this out loud, but it is true. So yes, this is that exam, and once you pass, you get your license and you get a registration, and yay, we celebrate and we begin the dance. So paper 1 has things to do with medical surgical nursing, and that is for adults and pediatrics. Then we have paper 2 that goes about midwifery, things to do with abnormal labor, normal labor, and post-delivery care. Paper 3 is about community health nursing and things that pertains to that and related subjects, while paper 4 is about it has psychiatry, teaching methodology, research. It has a combination of genres, but revolving around that area. There are usually different papers for those doing KRN, KRCHN and BSNs. But then you will be sitting at whatever paper you have trained for over 3.5 years, or for over 2 years, or for the 4 years or 5 years while you're training if you are BSN, and you will be good to go, because you will be able to ace the exam and get your license and then come make the money or come practice nursing. Now, making the money is not quite the ideal. I wouldn't say nursing is what will make you a lot of money, especially right here in Kenya. It can get you somewhere or some stepping stone, but contentment, you will have to bear with several scenarios and different employers and different amount in terms of salary, but then we make do with what we got, and yes, we keep keeping on and we keep strong. Until next time, Thank you for watching this, and bye.